Hey guys, Dr. Z again. Thank you for tuning in for the best care of your neck and back. Wanted to talk a little bit about today about why I became a spine surgeon. Main reasons I became a spine surgeon were a couple influences in my life. First of all, growing up, my mom was a microbiologist. I was constantly exposed to the rhetoric of things that she was talking about from work and bacteria and interacting with doctors about treating complex medical problems. I had a chance to visit her lab a couple times and see the actual interaction for myself. I became intrigued with the medical field and her ability to help her patients and the doctors take care of the patients that were helping her. Furthermore, my dad was a very mechanical person. He was an electrical engineer by trade, but basically could fix anything that broke anywhere in the house or anywhere that he encountered. He was fixing electronic devices, he was building things, and I was constantly exposed to the use of various tools that he taught me to use and techniques that he taught me to use in order to build and fix things around us in the home, in the yard, and anywhere he could find. There was one time my wife had a hair dryer that went completely dead, and somehow he was able to rewire the entire thing. It worked perfectly for the next 5 years. One of the biggest influences was, though, my experience as a physical therapist. I was a physical therapist for 4 years before returning back to medical school. And during those 4 years, I was able to treat patients on a regular basis. I was able to be exposed to a variety of different patients with total knee arthroplasties, meniscal tears, strains and sprains of ankles, and a variety of different injuries. The injuries that most intrigued me was the neck and the back. They were the most complex, and that's where we were getting our poorest results, meaning it was very reliable to treat a total knee arthroplasty patient who got a new knee, help them get up and down the stairs, help them get in and out of bed, strengthen their knee, and they would reliably get better almost every time. The neck and the back was more of a mystery, and I knew deep in my heart that there was going to be advances that were to come, and that our treatment of neck and back problems would eventually become more routine and more reliable than they were, and sure enough they are. And that's why I entered the field of spine surgery, because of my mechanical influence from my dad, my medical exposure that I got from my mom, and my experience in physical therapy. I knew I was going to get into a field where we can make a difference and we can get better at what we do. And sure enough, in the last 10 years, our field has exploded from things like stem cells and disc replacement and other techniques and ancillary treatments that we offer to help make neck and back surgery reliable, safe, and effective. So in order to learn more about this, tune in next time for the best care of your neck and back. Thanks, everyone.